Hello, everyone. Welcome to my clinic. I'm a general practitioner with the Nizami Hospital, and this morning I was asked a question about the importance of having a wellness check. Usually, a wellness check would be a full medical annual check or periodically, as it depends on individual states, to know what you have and just to know just basically what your health status is. So this varies in different aspects. We do have screening tests for common medical conditions. We do have things like hypertension, diabetes, which are the non-communicable diseases. So we have things like cholesterol levels, where we try to diagnose hyperlipidemia and other things. We also have effective markers that we do just to see if we have other communicable or infectious diseases also within the system. We have vaccine preventable diseases that we check. So overall, what are the importance of we having to know this as members of the society or members of the public? Now, when you sit, you may not necessarily know what you have going on in the system. It doesn't hurt for you to just know where you stand as a baseline for your investigations. So basic wellness checks can be done at an interval. Some people do it annually, some people biannually. Like there are certain investigations, like screening tests we do for mammography, for breast cancer with mammography, and then also pap smear for cervical cancer. Those ones also have durations depending on what the findings are. 2 years, 3 years before some are also being repeated. However, if you don't come to the hospital, sometimes you wouldn't know. So prevention is also still better than cure, which is also a common saying. But with all the aim of health promotion and preventive medicine, it's okay for you to always come in to see your doctors and also discuss certain things. You might have questions, you might have queries about certain things. You might have vaccines available for certain conditions that are preventable. You also have conditions that would also run within families that put other individuals at risk in the family, so you could screen for them, and you could also have other conditions that might be hidden that you wouldn't even know exist or it's just starting up. For example, some people would come into the clinic and then just have a routine check. We've had patients that we find tumors, early detection, maybe tumors that would subsequently turn out to be cancers. We've had people with bladder masses without knowing that there's something growing. We've had people with prostate disorders that we've caught early, turned out to have a biopsy and probably even turned out to be a cancerous change. We also have people that we accidentally find breast lumps during mammography, and then they also go in for subsequent treatment. So usually catch them early. You can also have that check. We find people that are also in pre-diabetic state or with impaired fasting blood glucose, and we'll also advise as appropriate start conservative management with lifestyle changes, diet, exercises. So it's not always that you find a pathology, but sometimes you also come in and then you know what it is, and then you know what you watch out for, because you might have some condition that is starting up but had not progressed. You could have some alterations in your blood pressure readings, and you could go home and be advised to have some monitoring, and then you're cautious of what it is, and then you also know that there's tendency for such things to change. So overall, the benefits of having a medical check would always outweigh the risk. And for individuals, of course, that already have chronic diseases that have been diagnosed, it would usually be a follow-up, and then say you're hypertensive, you would also want to have your normal routine follow-up with maybe the cardiology clinic or with an endocrinologist if you're diabetic or if you have thyroid disorders. So those would be routine follow-ups, but that doesn't still stop you from having a basic check when it's time for you to have that as indicated. So overall, I think health awareness and health promotion has increased globally with following the impact of the pandemic. So it will do you well to just have a health check and just know what your health status is at any given point in time.